How expensive is healthcare in your part of the world? For millions of Americans, a visit to the doctor has become a luxury in a way that they simply cannot afford. Let's tell you more about what a new survey reveals. It tells us about the staggering cost of healthcare that is forcing many Americans to even delay treatment, skip appointments, and even ration medicines. A survey of over 1,500 US adults by a financial services firm found 92% of those surveyed have delayed or avoided medical care because of the costs, with young adults being the worst affected. Imagine that. According to the study, more than 94% of those aged 18 to 28 said they had put off treatment for financial reasons, followed by Americans between 29 and 44 years of age. The report says the findings highlight a growing disconnect between having health insurance and feeling financially protected. Rising medical bills are allegedly pushing many American families to postpone treatment, cut back on essential spending, and fall into debt, reportedly. And gender also plays a role. According to the study, women are more likely than men to delay medical care, while age and insurance status further influence those decisions. According to a February 2026 analysis by a healthcare marketplace, an uninsured visit to a doctor's office costs an average of $171 US across major US cities. And the financial strain is widespread, by the way. Around 85% of Americans say they carry medical debt. 85%. A February poll by an American non-profit organization estimating total medical debt at $220 billion US. Total medical debt, $220 billion US. That's nearly $960 US for every adult with medical debt. The cost of delaying care is proving severe. A 2025 survey by the same American non-profit organization found that nearly 1 in 5 adults said that their health worsened after skipping a doctor's visit. Among people aged 64 and younger, that number jumps to 42%. Prescription medicines are also becoming less affordable. Another study by the American non-profit organization found 31% of adults switched to over-the-counter medicines because prescription drugs were too expensive. 19% admitted skipping doses or splitting pills to make their medication last longer. Imagine that. That's the extent to which people are going. The Trump administration, remember, has proposed measures to bring down healthcare costs, including lowering prescription drug prices. Healthcare costs across the US reportedly also rising amid higher inflation. After easing to 2.4% in February, inflation in the US climbed to 4.2% in May amid the Iran-US war. Healthcare costs, in fact, are further projected to continue rising across the US through 2027, suggesting affordability will continue to remain a major concern for millions of Americans, unfortunately. To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.